COVID-19 vaccine. Most Americans are in favor of vaccine passports. Nearly 6 months after the first COVID-19 vaccines were approved, Americans are increasingly getting accustomed to vaccination, while adjusting to loosening restrictions and business reopening nationwide. This video brought to you by HealthyRN Ways channel that talks about the COVID-19 pandemic. Video posting every Monday, Wednesday and Friday. To see my other videos, see the link at the end card of this video. As more people get vaccinated, fears about the COVID-19 vaccines are reaching all-time lows. According to our latest vaccine tracker, only 13% of our surveyed audience would definitely not agree to take a free COVID-19 vaccine shot. This is the lowest rejector number we've seen since starting the survey in December. But as a return to pre-pandemic life seems imminent, Americans are on the fence about something new: vaccine passports. Everyone who gets vaccinated receives a vaccine card, but those are easily forged and may be lost or destroyed accidentally. Vaccine passports would likely digitize this information. Currently, multiple private sector companies are developing digital systems to collect and verify personal COVID-19 vaccine status and potentially also testing information. The idea is this would live in a digital app the user can present when boarding an airplane or entering a restaurant for indoor dining. But for those without access to smartphones, it could also be a written certificate. People are divided on vaccine passports. While the support for vaccine passports varies by the situation, survey respondents who support vaccine verification are more likely to be vaccinated themselves. They identify more often as Democrats, Republicans, millennial, men and women. Gen Z, people between the ages of 18 and 24, appear more against the idea, which aligns with our previous findings showing that they also tend to be more hesitant toward the COVID-19 vaccines in general. Based on statements from the Biden administration, there won't be a federal vaccination verification system or vaccine mandate in our future. The U.S. will issue some form of guidance for states and public companies looking to implement a vaccine passport system. Some states are coming out strong against their implementation. Arizona's governor signed an executive order barring local governments from making vaccine passports, a requirement for people to enter businesses or get services. Florida and Texas did the same, and Tennessee's governor is supporting legislation against it. There are states who are already working to implement a version of verification, like New York and Hawaii. Many universities are also requiring proof of vaccination. Hesitancy toward vaccine passports may also stem from ethical considerations. Requiring proof of vaccination can further place people who don't have easy access to technology like smartphones at a disadvantage, as many vaccine passports are built around digital apps. Vaccine passports, specifically those designed as digital apps, raise concerns about the security of a user's medical information. Places that institute verification will likely need to protect users with robust privacy policies. Vaccine verification depends on the situation. Approval for vaccine verification varied by scenario. According to our data, people are more comfortable with the idea of verification if there's a precedent for this type of documentation in the space, like international travel, schools, concerts or sporting event. Offices or workplaces, domestic travel. For many respondents, vaccine verification makes sense for air travel or international travel. 65% were in favor of vaccine verification to travel abroad. These situations already required health and safety protocols over the past year, like a quarantine period or negative COVID test result. About half of respondents support vaccine verification for sporting or live music events. Many concert companies and sporting venues are already implementing vaccine verification. Ticketmaster will be checking vaccine status for concerts. Vaccine verification is not a new concept. Proof of vaccination is already required in many instances throughout the world. For example, travel to some areas where the yellow fever virus is present requires proof of vaccination called International Certificate of Vaccination or Prophylaxis. Schools and workplaces have also historically required certain vaccinations, like tetanus and chickenpox shots. In many states, Teachers were given early priority for vaccination to encourage safely getting back to in-person teaching. As we approach herd immunity, somewhere in the range of 70 to 80% of the population fully vaccinated, these questions will become less pressing. But for now, vaccine passports will be a patchwork of different systems and policies throughout the U.S. The Vaccine Tracker is a biweekly measurement of Americans' attitudes and behaviors around COVID-19 and the vaccine. The survey is fielded online every other week. The total sample matches U.S. Census estimates for age, gender, race, ethnicity, and region. It consists of 1,000 Americans from December 16, 2020, until February 26, 2020, after which the sample size increased to 2,000 per wave. Vaccine rejection is at an all-time low. Americans are split on whether they support verifying their vaccination status through vaccine passports as they return to public spaces. If you lose your COVID-19 vaccine card, if you've gotten vaccinated against COVID-19, you should also have received a vaccine card created by the Centers for Disease Control and Prevention, CDC. The card includes the date of your dose, which vaccine you received, where you received your shot, and other important information. If you haven't yet received a COVID-19 vaccine, you'll get your card when you do get the jab. Experts say you should hang onto your card and keep it safe because you will likely need it later. But accidents do happen. If for some reason you were to lose that card, you can go back to the location that you got it and they should be able to provide you with updated documentation of it. Replacing a lost or damaged card. Even with diligent safekeeping practices, you can misplace or damage a card. If you received your vaccine at a pharmacy or through your healthcare provider, you can reach out to that pharmacy location, clinic, or hospital to receive a card replacement. You can also contact your vaccine provider if for any reason you did not receive a vaccine card. Any site that's giving out these vaccinations has a record. Most of it's being submitted to state and national registries, as well. If you received your vaccine through a large pop-up site or mass vaccination event at a stadium, a convention center, or another location that is no longer in operation, you may need to track down a replacement card through the health department in charge of running that site. You can also contact your state health department's Immunization Information System, IIS. In some countries, apps are available with all the updated test and vaccine on smartphone of individual, which include all the information of a person and his family. Keep your original COVID-19 vaccine card safe with other important documents and avoid laminating it. You may need it in the future if booster shots are necessary or if proof of COVID-19 vaccination is required for access to events or for travel. Experts recommend taking a photo of your card as a backup. If you do lose the original or it becomes damaged, you should be able to obtain a replacement from your vaccine provider or health department. COVID-19 vaccine cards serve several purposes. First, the card tells you and your vaccine provider which COVID-19 vaccine you've received. If you've received a 2-dose vaccine, your provider will match you with a second dose from the same vaccine manufacturer and schedule you to return for your second dose at the appropriate time. Even once you're fully vaccinated, the card remains a valuable record and tool. It may become important if there are booster shots in the future. Certain vaccines may require booster shots. The card also contains important information for each vaccine dose you received, including the dose expiration date and lot number. Both of these items are FDA drug labeling requirements. The expiration date may be important for timing your potential booster shot appointment in the future. And the lot number is crucial in medication labeling to track the complete manufacturing history of a drug. When vaccine rollout initially began, and rare cases of anaphylaxis, severe allergic reaction, were reported, the CDC was able to determine that the cases were observed with doses from multiple lot numbers, rather than all coming from the same supply. In other words, the cases were not a result of a manufacturing issue but instead rare instances of allergic reaction at a rate on par with that of other vaccines. The vaccine card will also be what serves as your proof of COVID-19 vaccination where needed. It is suspected that there will be the possibility that places will start requiring kind of a vaccine passport in order to do certain things, perhaps traveling or entering certain events. This may become digitalized down the road. They were used to our healthcare providers keeping track of our vaccination history. If you work at a healthcare facility or if you attend college, you need to have a record of your vaccinations. Most of us don't really pay attention to that. We contact the pediatrician, or we contact our doctor. They give us a printed out list. We give it to our employer, and we don't have to think about it. With the pandemic, millions of people are being vaccinated for COVID-19 on a daily basis. And that's why the vaccine card is such a useful tool and serves as an immediate medical record, as well as a future one. Right now, we might know our COVID-19 vaccination dates off the top of our heads because of how serious the pandemic has been and how much anticipation there was for vaccine development and then dose availability as rollout began. It seems like we'll never forget. But it really will become difficult to remember, and the card is helpful in that sense. Keeping your card safe. Currently, you do not need to carry your vaccine card with you. Rather than storing it in your handbag or wallet, where it could get lost, stolen, or damaged, Lynch recommends stashing it in a safe place where you keep other medical records or important documents. Definitely make sure to take a picture of the card on your phone in case you are traveling or attending an event where they want to see a copy of it. I also recommend emailing it to yourself. Sending a photo of the card as an email attachment allows you to store the image somewhere other than your phone as a backup. If you do take a photo of your vaccine card, don't share it publicly. Despite the popularity of posting COVID-19 vaccine selfies showing your contribution to keeping yourself and others safe, it is a good idea to refrain from posting an image of your vaccination card on social media. Your vaccination card does include some identifying information which can potentially be used by identity thieves. Although laminating your card might seem like a good step toward protecting it, experts do not recommend this. Laminating your card would prevent the capability to add more information in the future, such as additional doses or boosters if necessary. If you've already laminated your card, not to worry. A laminated card won't prevent you from getting your second dose of a 2-dose vaccine or from receiving a booster. If you'd like to add some protection to your vaccine card, which you can pick up at any office supply store, people are most likely to support vaccine passports in situations where other forms of verification already exist, like domestic and international travel. Your COVID-19 vaccine card contains important information and serves as proof of vaccination and a medical record. If you lose your vaccine card, you should be able to obtain a replacement through your vaccine provider. Experts recommend taking a photo of your COVID-19 vaccine card and storing the original with other important documents. Please like, share and subscribe to my channel. Thank you for watching. See you on my next videos. Ma salama.